Hi guys, welcome back to another video. It's me Nikita helping you to come to the UK as an international student or a healthcare professional. Now a few people including Sam Brighton, Harshdeep Singh and Princess Jam asked me a few days ago about what is the scope of physiotherapy practice in UK. And today's video is going to be all about answering that question. So if you are interested in this content, please keep watching. So the first thing when you think about understanding the scope of practice in any country is knowing what are the different sectors of physiotherapy within that country. So the four main sectors for physiotherapy in the UK or in the NHS are MSK physiotherapy, neurophysiotherapy, cardiorespiratory physiotherapy, and again this can be divided into wards and ICU and community, but we'll get into that later, and pediatric physiotherapy. But other than these four sectors, the other two sectors that I think are quite important are women's health physiotherapy and veterinary physiotherapy. So veterinary physiotherapy is physiotherapy for animals specifically. So obviously this can be either with dogs or horses that are most common. If you are interested in finding out more information about the courses that specialize in any one of these sectors, I'm just going to leave the links for the videos that I've created previously about physiotherapy universities right now in this video. But moving straight ahead, the second most important thing to understand when you are practicing physiotherapy in a country is the setting in which you are going to practice. So in the UK, you have two main settings within the NHS. It can either be an acute setting or a community setting. So the acute setting are more short-term rehabilitation periods. For example, if you've had a trauma in an MSK setup, you may be a physiotherapist working with fractures, dislocations, sprains, whatever it is. But it's more within the hospital setup. And again, for a cardiorespiratory physiotherapist, this could be maybe working with people after surgery or after an acute medical episode. Whereas for a community setup, it's more in terms of longer term rehabilitation, and this happens in the form of community centers or clinics. And like I said before, that you can obviously work in the community setup differently as compared to the fast-paced hospital setup or the acute setup. Now, what is a major advantage in the UK is that both of these setups have very strong MDT, that is multidisciplinary team reviews. So it's not like one setup has the preference of, you get to work with doctors, while the community setup don't really get that. I am a band 6 physiotherapist within the community setup, and I obviously get to work very closely with doctors, occupational therapists, nurses even. So it's not that one setup is better than the other, but it depends on your personal preference of where you choose to work and what interests you. And if you want to find more information about understanding the job description and applying for these jobs specifically, I'm just going to leave the link for my previous video about where I've explained this. Hey guys, so I know many of y'all would like to connect with me personally and ask me if there's any way that y'all could ask all of your queries and have some one-on-one time with me. And that's exactly what I'm able to offer you right now. So as of today, I'm going to be able to release my own website where you can book sessions with me to discuss the best route for you to come to the UK as a healthcare practitioner, any guidance or assistance that you may need for your HCPC application, your first job in the NHS, or even choosing a university to study physiotherapy in the UK. So if you are interested in this content, please do not forget to check out the link for my website left by me in the description box below. And I'm looking forward to meeting many of y'all. But coming on to the third point, which is understanding the banding or understanding the hierarchy of roles within the NHS. So for example, if you work in the NHS, you will know that if you have your HCPC registration, you are now licensed to practice as a healthcare practitioner within the UK. But if you do not have it, you can now work as a band 4 physiotherapist assistant or an occupational assistant or a healthcare assistant, because these are jobs for individuals who do not have their HCPC registration. Once you have received your HCPC registration, you are now licensed to practice as a healthcare practitioner in the UK, and so you can take up band 5, band 6, band 7 roles. Now, I'm just going to explain a little more about these roles. So if you are at a band 5 level, most of the band 5 level jobs are rotational jobs. So that means that you will be asked to rotate into each of the different sectors, that is MSK, cardio, neuro, pediatric, community, women's health, etc. Now, these job roles can obviously be different and can look very different for individuals. So I would suggest that you check out these when you are applying for them. But as you move to a band 6 role, it is a more specialized role. So obviously some of the band 6 roles still involve rotational based jobs where you are into different sectors. But most of the band 6 roles are specialized. So that means you now work either in MSK or neuro or pediatrics or cardio. and that means that you only deal with one specific patient population as a part of your job. For example, I am a band 6 pediatric physiotherapist, so I work only with pediatrics, so I do not work with MSK at all. Now coming obviously on to band 7. So band 7 are individuals who have a more evolved job description. So these are people who obviously have a clinical caseload and they are highly specialized in that particular caseload, but they also have some managerial responsibilities. So they may be asked to supervise their band 6s, 5s or even 4s, and they may be even asked to do some form of teamwork. And finally, you come to band 8. So band 8 are team leaders who basically have to overlook the entire managerial side of working a team, and they may have very few job responsibilities related to clinical work. So if you are interested in knowing more about the salaries for each of these jobs and the bandings, I'm just going to leave the link for that right here above. But also you need to understand that if it is your aim to progress to a band 7 or a band 8 role, it might be quite helpful for you to do some jobs or some courses that involve doing some leadership or some leadership related training, and some master programs in the UK actually offer this as a module. So if you are interested in finding out more about it, I'm just going to leave the link for one of my videos right now. But also this is a lot about the NHS. So what happens if you practice in the private sector? What is your progression going to look like? So in the private sector, a lot of your progression is based on the opportunities that you have as an individual, the skills that you want to improve, and what it is that you are looking for. So there is no fixed set of progression within the private sector, and it's going to be dependent a lot on you as an individual. Now finally coming to the last part of this video, and just before I reach there, I just want to say that if you have liked this content so far, please do not forget to hit the like button, just so that this video gets spread to more individuals across the YouTube community who actually want to come to the UK as a healthcare practitioner or as a physiotherapist. But coming to the last point, and that is advanced clinical practice. So in the UK, there's something known as advanced clinical practice, where you are allowed to perform some responsibilities that are not allocated within your job description, provided that you have a good training or a good background in it. For example, as a physiotherapist, you are not allowed to prescribe drugs or to write down any kind of drugs that a patient should receive. But if you've completed a good training or a good PG certificate or a master's course in prescribing medication, you can now be allowed to be a non-medical prescriber. And this is again within the MSK or the neuro setup. But the other roles in advanced clinical practice for an MSK person could be injection therapy, acupuncture therapist, especially those who are associated with the Acupuncture Chartered Physiotherapist Association. Can even be first contact practitioner. Now, if you are someone in the pediatric background, you can again have advanced clinical practice in the form of serial casting or maybe even Botox injections and things like that. And again, this can look quite different if you are in the neuro or in the cardiorespiratory setup. Now, I obviously am not an expert and I cannot give you advice related to this. But if you want to find more information related to advanced clinical practice in the UK, I'm just going to leave the links for some of the resources that I found in the description box below. So definitely go and check it out. So yes guys, I hope that this video was useful and you found some information related to the scope of practice of physiotherapy in the UK. Now if you found this content useful, please do not forget to hit the thumbs up or the like button for this video, just so that it gets shared more among the users of YouTube who want to actually come to the UK as a healthcare practitioner, and so that we strengthen our community of healthcare practitioners in UK. But if you like this content, please do not forget to hit the subscribe button, just so that you receive all of the weekly updates from my channel. And finally, if you have any questions, doubts or feedback related to this video, please do not forget to leave them down in the comment section below, because I try to personally answer each and every question that's down there, but I also try to make some videos that can be more informative for our wider audience and for our wider group of healthcare professionals in UK. But that's it. Take care you all. Bye.